Pathophysiology. Lactose is a major carbohydrate that is present in milk and dairy foods. Lactose is in disaccharide form, which consists of glucose and galactose. Lactose must be hydrolyzed by lactase to glucose and galactose in order to be absorbed by the small intestinal mucosa. For someone with lactose intolerance, the lactase enzymes are absent or deficient. It prevents the hydrolysis of ingested lactose. In the small intestine, the undigested lactose osmotically attracts fluid into the bowel lumen. Too much fluid in the digestive tract will cause diarrhea. In the large intestine, the undigested lactose is fermented by colonic bacteria to yield short-chain fatty acids and hydrogen gas, which causes abdominal pain, bloating, and flatulence. Diagnosis: hydrogen breath test is a test where a doctor measures the amount of hydrogen in your breath after drinking a liquid high in lactose. Result shows high level of hydrogen means that you are not fully digesting lactose. Blood test will be done after 2 hours of drinking liquid high in lactose. If the result shows the glucose level in the blood doesn't rise, it means your body isn't properly digesting lactose. Treatment: the main treatment for lactose intolerance is by dietary management. Limit the intake of food containing lactose, choose lactose-free products, take plant-based milk, tofu, fatty fish and kale to get sufficient calcium and vitamin D. Possible nutritional consequences of lactose intolerance. Number 1, high possibility of nutrient deficiency like calcium and vitamin D due to dairy avoidance. Lactose intolerance also indirectly can impair the maintenance of our normal bones and teeth due to calcium deficiency. Other than that, individuals with lactose intolerance also have a risk of having diarrhea, gas, and bloating after consuming dairy products. Nutrition assessment. Anthropometric measurement for infants and children should be plotted on a growth chart and evaluated because decreased weight for height measurement is associated with food intolerance. Possible biochemical abnormality. Food intolerance are not caused by an immune system reaction. Hence, a high level of immunoglobulin IgE should be excluded since it indicates food allergy. However, immunoglobulins IgG or IgG4 present against food antigen. Nutrition-focused physical examination is important to assess patients with adverse reaction to foods. Some clinical symptoms of food intolerance are abdominal cramping, flatulence, diarrhea, and nausea. Other aspects regarding symptoms that are needed to be assessed is the duration of onset following food contact, where symptoms begin within a few hours after food intake and can be delayed up to 48 hours, making the offending food difficult to pinpoint. Next is the level of severity of the symptoms and the frequency of the adverse reaction to foods. Also, other physical signs that may present such as malnutrition and poor growth, failure to thrive. Through food nutrition-related history, the diet history of patient is taken to identify the offending food, and the child feeding history like breastfeeding, weaning, and complementary feeding to assess the relationship between early feeding practices with risk factors of food intolerance. Next, we move to the most common nutrition diagnosis for lactose intolerance. Number 1 is inadequate calcium intake related to inability to tolerate milk products as evidenced by daily average calcium intake less than 200 mg per day. Number 2 is malnutrition related to altered gastrointestinal function as evidenced by diarrhea and vomiting. Lastly, number 3 is food and nutrition related knowledge deficit related to lack of nutrition education about lactose intolerance as evidenced by not knowing the duration of onset following the food contact. Let's take a look at nutrition intervention for lactose intolerance. A sample case, Ali is an 11-year-old Malay boy and weighs 23 kg and 135 cm. He is classified as severe thinness according to BMI cut-off points for boys as stated by WHO 2007. The calcium level stated is less than 200 mg per day. For NFPF, Ali has thin extremities, square shoulders, and diarrhea. So how much does Ali need for energy and micronutrients in a day? Based on the calculation, the Schofield formula is more suitable to fit with Ali's condition, as it includes stress factor 1.5, which indicates normal active child with mild to moderate stress and malnutrition. Next, according to IOM 2005, the recommendation of carbohydrates for children aged 4 to 18 years old is 45 to 65%. Ali is prescribed 30% of protein, which is the maximum range for protein requirement in a day. He requires a high protein diet due to malnutrition and to promote growth. Based on the calculation, the fat recommended for Ali is 25% of total calories needed. What are the objectives of the intervention? Here are some short-term objectives in managing Ali's condition of lactose intolerance. Other than that, the long-term objectives are as follows, which is important to monitor Ali's health. What are the nutritional strategies in order to achieve the objectives? The following are the nutritional strategies provided for Ali in managing lactose intolerance. Nutrition monitoring and evaluation. Kids should be closely monitored if any of the intolerance symptoms still present. Their weight changes should also be routinely plotted on the growth chart to see any improvement of nutrition status. Besides that, monitor for adequacy of food intake for their growth. After the intervention, nutrition reassessment should be taken. Blood tests are done to evaluate biochemical profile, especially level of calcium for kids who are lactose intolerant. Besides that, anthropometry measurements such as weight and height to evaluate any changes.